Hey, good morning. I'm Julie. I'm one of the nurse practitioners taking care of Elizabeth today. Are you Mom?
Yes.
Are you guys ready to join rounds?
Yeah, be great.
Okay. Let's go ahead and have everybody on the team introduce themselves so that Mom can know who's all attending on rounds.
I'm Lindsay. I'm the registered dietitian.
I'm Jill. I'm the nurse for the day.
I'm Andrea. I'm Elizabeth's mom.
I'm Amanda. I'm the pharmacist.
I'm John. I'll be the respiratory therapist.
I'm Blake. I'm one of the ICU fellows.
I'm Josh. I'm one of the ICU attendings.
Okay, so Elizabeth is our 8-day-old with hypoplastic left heart syndrome who's now post-op day 2 from a Norwood BT shunt, and then post-op day 1 from sternal closure. And then, Jill, if you want to go ahead and share your pertinent data.
So for Elizabeth, neuro-wise, she is on a fentanyl drip at 3. She got 1 bolus overnight, and she's had 2 boluses today so far. Respiratory-wise, her respiratory rate is 20s to 30s. Her stats have been 75 to 85. Her end titles have been 25 to 35. She's clear to course. Her peak pressures have been 21, but she hasn't had any increased work of breathing. Cardiovascular-wise, her heart rate has been 150s to 160s. She's in sinus rhythm. She does have a murmur. Blood pressures have been 65 to 75 over 30s to 40s by cuff and art line. CVPs have been 8 to 13. Her RA has been 7 to 10. Head and flank nears have been 40s to 50s. Her toe temps have been greater than 30. She's on a heparin drip at 18, epi 0.03, milrinone 0.5. Her PTT goal is 70 to 90, and her last PTT was 82. Her lactate is 1.3. She has a right pleural chest tube that's had 8 out today, 21 in the last 24 hours. Left pleural, 8 out today and 16 out 24 hours. And a mediastinal tube that's had 12 out today and 14 in the last 24 hours. She has atrial and ventricular wires. She's being paced AAI at a rate of 140. Output is 5 and sensitivity is 0.4. FENGI, she is NPO. She does have a Foley. She has put out 1.3 mLs per kilo of urine. Her fluid balance is currently negative 100. She's on IV fluids at 7 mLs an hour. Infection control wise, she's on Cefurox and Vanc. Her hemoglobin and hematocrit are 13 and 38. Access wise, she has a right radial art line. She has 3 common atrial lines. Number 1 has CVP with a medline. Number 2 has fentanyl with a carrier. Number 3 has CVP fluid, and she has a right hand PIV, which is saline locked. All of her lines were put in the OR, so they're all 2 days old. Skin integrity wise, she is on a geomat and gel pad, and she has no skin issues.
The patient is currently in the vent weaning protocol. Our goal PCO2 is 40 to 50. Our pH goal is 7.3 to 7.4. The current settings, she's in S7V PRVC, tidal volume of 25 mils, which is 8 per kilo, PEEP of 5, rate of 22, pressure support of 10, and 40% FI2. Peak pressures are in the low 20s. The ET tube is at T2 to T3. It's a 3.5 cuffed ET tube. The cuff is currently down and is taped at 8.5 centimeters. There is an air leak at 20. I am currently suctioning pale thin secretions. Our current respiratory treatments is PEP therapy Q3 for right upper lobe collapse, and I have no other concerns currently.
Okay, thanks guys. That was a really nice review of the patient. So I have very little to add assessment-wise. So I'll just review our current issues and then our plan for the day. So on exam, pertinent physical findings is that there seems to be less edema than yesterday. I hear better breath sounds, especially in the right lung base. The extremities are warm, she's well perfused, there's a prominent shunt murmur, but she does appear quite sedated on exam. So overall, I think she continues to progress nicely. She did well following sternal closure. Our current issues are respiratory failure, low cardiac output, secondary to substantial pulmonary blood flow and moderate TR, and then resolving acute kidney injury and edema. So Concerning the respiratory failure, we just did a blood gas at 8 that showed that she was pretty overventilated, so pH of 7.46, CO2 of 32. The compliance continues to improve, and we've weaned the rate a little bit, so my plan is to continue to wean the rate. We'll put her in an ERT in the morning and then hopefully extubate in the morning. We should probably wean her oxygen as tolerated as well, since she has generous pulmonary blood flow. And then we can also back off the PEP to Q6 since the chest x-ray is improved. Regarding the low cardiac output, she's much warmer this morning. Her lactate is low and organ function is improving. NIRS are stable. So I'd like to go ahead and wean the epi off throughout the day, and then we'll just shoot to keep the blood pressure above 60, the systolic. I'd like to continue milrinone for now. And then, as Jill said, the So overall, I'm pretty pleased. I think she'll be ready for extubation tomorrow if things go well tonight. I think that's all I have. Pharmacy, did you have any concerns?
Yeah, she's currently on Cefurox and Vanc. Both are set to fall off today. If that's still the plan, then I don't need a Vanc level for today. All of her other meds are currently dosed appropriately for her improving renal function.
Yeah, I don't have any other infectious concerns, so I think that's fine to just go ahead and let them fall off, and then we won't check a trough. Blake, do you mind going over the safety checklist for us?
Yeah, Julie, I'd love to. So, Jill, it sounds like all of your lines are functioning okay,
Yes.
and it doesn't sound like any of them can be removed.
No.
And Foley care is being performed every shift.
Yes.
It doesn't sound like the Foley can come out.
No, it sounds like we're following urine output pretty closely, so we should probably keep it in another day at least.
Any trouble repositioning her or bathing her?
No.
And we're doing HAPU prevention strategies.
Yes.
And we talked about adjusting her meds for organ system dysfunction, so I don't think we need to do anything with that. We also talked about the Zantac, so she's on GI prophylaxis. And we talked about the 10A. I think that's the only medication level that needs to be ordered. And what do you think about the x-ray frequency?
Probably needs to stay daily, but if it's written for more frequent than that, we can probably back off.
Okay, so we can wean that a little bit, and we won't set her up for intracardiac line removal or anything like that. So I think the next thing is let's just make sure that the daily goal sheet is completed. So Jill, do you feel like you have a good understanding of what our main problem is and what the main goal is, and do you mind going over the daily goals?
Today, Elizabeth's primary problem is respiratory failure. Our primary goal is to wean respiratory support for extubation in the morning. Her goal SpO2 is 75 to 85%. I didn't hear a goal FiO2.
I think it's probably reasonable to wean the FiO2 to about 40% and just park it there until we extubate.
Okay, her goal FiO2 is 40%, and we are weaning respiratory support for extubation in the morning. Cardiac-wise, we are weaning the epi for a goal blood pressure of systolics greater than 60. FENGI-wise, we're going to start feeds today at 1 ml an hour, and her goal fluid balance is negative, and we would like her to be negative 150 over the next 24 hours. Heme-wise, her goal hemoglobin is 13. She is on heparin for shunt prophylaxis, and we're following anti-10As for a goal of 0.3 to 0.7, and we're going to add aspirin today. Neuro-wise, we are going to wean the sedation, and the goal is to stop sedation at midnight for extubation in the morning.
Okay, can we just go over the orders really quick? So I got wean the epi off to keep the systolics above 60. We'll start Lasix Q12. We'll increase. Did I miss anything else?
So overall, it seems like she's doing quite well despite a really rough post-op night, and she's tolerated sternal closure quite well. I think really the goal for today is to wean the ventilator support, diurese a little bit, maybe start some small feeds. Mom, do you have any questions or concerns about our plan for today?
No, I'm really happy. I think she's doing really well. Thank you so much.
You clear about what our plan is for today?
Yes, definitely.
Great. Does anyone else have any questions or concerns? Are we all clear on the plan of care for today? Great. Well, now I'd like to talk about single ventricle physiology for a few minutes.